Hello, everyone. If you are in your 60 seconds, 70 seconds, or beyond, and you wake up every day living with that dull, persistent pain in your knees, back, shoulders, or joints, please know this: you are not alone. Chronic pain does more than exhaust the body. It quietly erodes your quality of life. It makes you hesitant to move, steals your sleep, dulls your joy, and little by little causes you to withdraw from the life you once enjoyed. My name is Dr. Leslie Kernisan. I am a board-certified geriatrician and the founder of Better Health While Aging. Over many years of caring for older adults, I have met countless patients who believed, just stop by the pharmacy and grab a few pain pills. But the truth is far more complicated. Not every pain reliever is safe, and over-the-counter does not mean harmless, especially for an aging body. That is exactly why today's podcast exists. In this episode, I will be talking about a group of medications that many people over 60 take every single day, over-the-counter pain relievers. Familiar names like Tylenol, Advil, and Aleve may seem routine, but when used incorrectly, they can have serious effects on the liver, kidneys, heart, stomach, and even the brain. In this program, I will help you understand which pain medications are safer for older adults, learn why some pain relievers pose hidden dangers, recognize common mistakes that many people unknowingly make, and most importantly, discover how to manage pain effectively while protecting your long-term health. My goal is not to make you afraid of medication. My goal is to give you knowledge so that every pill you take is an informed decision, a thoughtful choice, and one that truly supports your health. If you care about staying healthy, clear-minded, and independent as the years go by, I invite you to join me now for this very important conversation, too. The over-the-counter pain relievers most commonly used by older adults. When it comes to over-the-counter pain medications, most older adults immediately think of a few very familiar names. These drugs are so familiar that many people take them daily without even thinking of them as medicine anymore, more like a normal part of everyday life. But it is precisely this familiarity that creates risk, especially when we do not fully understand what we are taking. In reality, most people over the age of 60 who reach for pain relief fall into one of two main categories of medications. The first group is acetaminophen, most commonly known by the brand name Tylenol. Outside the United States, it is often called paracetamol. This medication is widely used for mild to moderate pain and for reducing fever. Many people choose Tylenol because they believe it is gentle or has fewer side effects. That is partly true, but only within very clear limits, especially when the medication is used regularly or long-term. The second group is nonsteroidal anti-inflammatory drugs, or NSAIDs. This category includes household names like ibuprofen, Advil, and naproxen aleve. These medications are often seen as stronger and more effective, particularly for arthritis pain, muscle aches, or back pain. And because they tend to work quickly, many older adults take them frequently, sometimes even every single day. Here's where the real problem begins. These two groups of medications are not the same, not just in how they relieve pain, but in how they affect the aging body. The liver, the kidneys, the stomach, the heart, each can be impacted in very different ways. A medication that is safe at the right dose can become dangerous when used incorrectly or taken long-term without proper oversight. What is especially concerning is how many older adults choose pain medications based on word of mouth, advice from friends, or simply the belief that, I've been taking this for years and it's been fine. But a body at 30 or 40 is not the same as a body at 60, 70, or 80. Quiet internal changes mean that the very same pill can have very different consequences as we age. That is why, in the next section, I will walk through each of these medication groups in detail so you can clearly understand which options are safer, which require caution, and why. Before we continue, I would really like to hear from you. If you are currently using pain relievers regularly, please leave a comment with the number 1. If you do not use pain relievers, or only use them very rarely, please leave a comment with the number 0. Your responses will help me better understand your real-life situation, so the next parts of this discussion can be as relevant and helpful as possible. 3. Acetaminophen, Tylenol, why it is considered the safest choice for older adults. Among all over-the-counter pain relievers available today, acetaminophen, most commonly known by the brand name Tylenol, is widely regarded by geriatric specialists as the safest option for older adults when it is used correctly. This point cannot be overstated because as we age, the body becomes far more vulnerable to medication side effects. Acetaminophen has two primary functions: pain relief and fever reduction. Unlike anti-inflammatory drugs such as ibuprofen or naproxen, acetaminophen does not have strong anti-inflammatory effects. Instead, it works mainly in the brain, where it reduces the perception of pain rather than acting broadly on multiple organs throughout the body. This unique mechanism is precisely why acetaminophen tends to be gentler on the stomach, kidneys, and cardiovascular system compared with many other pain medications. When taken at appropriate doses, acetaminophen is generally very safe for older adults, even when used over long periods of time. Most experts recommend that older adults do not exceed 3,000 milligrams per day, and in many situations, especially when there are concerns about liver function, 2,000 milligrams per day is considered a safer upper limit, although the U.S. Food and Drug Administration allows a maximum dose of up to 4,000 milligrams per day. That level should only be used briefly and is not appropriate for long-term use, particularly in older individuals. The most critical organ to consider with acetaminophen is the liver. This is the organ responsible for processing the drug. Taking too much in a single day, or taking high doses repeatedly over several days, can overwhelm the liver and lead to serious damage. The risk is significantly higher in people who already have liver disease, drink alcohol regularly, or are taking multiple medications that also rely on the liver for metabolism. Another commonly overlooked issue is that acetaminophen is not found only in Tylenol. It is an ingredient in many combination products, including cold and flu remedies, nighttime cough medications, and even some prescription painkillers. Without carefully reading medication labels, it is surprisingly easy to exceed the safe daily dose without realizing it. In terms of pain control, acetaminophen is best suited for mild to moderate pain. For severe inflammatory pain, such as advanced arthritis, some people feel it is not strong enough. However, the trade-off is important. Acetaminophen offers pain relief with the lowest overall risk, especially when compared to non-steroidal anti-inflammatory drugs. And for older adults, long-term safety is often far more important than fast or dramatic pain relief. In the next section, we will turn to the other major group of pain relievers medications that may feel more powerful, but also carry significantly greater risks for the aging body. 4. NSAIDs, ibuprofen. Strong relief, but serious risks for older adults. Alongside acetaminophen, the other major group of over-the-counter pain relievers widely used today is NSAIDs, short for non-steroidal anti-inflammatory drugs. The most familiar names in this category are ibuprofen, Advil, and naproxen, These are the medications many older adults turn to when they feel that Tylenol is not strong enough. There is no question that NSAIDs can be more effective in many situations, especially for pain driven by inflammation, such as arthritis, back pain, muscle soreness, or pain after injury. These drugs work by blocking inflammatory chemicals in the body, which allows them to reduce both inflammation and pain at the same time. This powerful mechanism is exactly why NSAIDs often provide faster, more noticeable relief in the short term. But this is where the serious concern begins. The way NSAIDs work does not limit their effects to the painful area alone. They impact multiple vital organ systems, and in older adults, those effects can be dangerous. First, there is the risk of gastrointestinal bleeding. NSAIDs weaken the stomach and intestinal linings, natural protective defenses, and interfere with normal blood clotting. As a result, the risk of ulcers and internal bleeding in the stomach or intestines rises sharply, even when these drugs are taken at recommended doses. In older adults, this bleeding can occur silently and become life-threatening before anyone realizes what is happening. Second, NSAIDs can significantly affect the kidneys. These medications constrict the blood vessels that supply the kidneys, reducing blood flow to these organs. Over time, or sometimes quite suddenly, this can lead to declining kidney function, especially in people who already have kidney disease, take blood pressure medications or diuretics, or are dehydrated. Third, NSAIDs can raise blood pressure, cause fluid retention, and lead to swelling in the legs and ankles. This fluid buildup can worsen conditions such as heart failure. In addition, multiple studies have shown that long-term NSAID use is associated with an increased risk of heart attack and stroke, particularly with prolonged or frequent use. Because of these risks, major medical organizations, including the American Geriatric Society, recommend limiting or avoiding oral NSAIDs in older adults for chronic pain management, especially for long-term arthritis pain. When NSAIDs are used, they should be taken for the shortest possible time, at the lowest effective dose, and under medical supervision. In the next section, we will explore safer alternatives to oral NSAIDs, starting with topical anti-inflammatory medications and other pain relief options that carry far less risk for the aging body. 5. Topical NSAIDs, a safer pain relief option for older adults with joint pain. Given the significant risks associated with oral NSAIDs, many people naturally ask, is there an effective way to relieve pain without putting my body at risk? The answer is yes, and that option is topical NSAIDs. In recent years, medicine has made an important advance with the development of nonsteroidal anti-inflammatory drugs applied directly to the skin, most commonly diclofenac gel. In the past, this medication was available only by prescription. Today, an over-the-counter version is widely available, making it far more accessible for older adults. The greatest advantage of topical NSAIDs is that they work locally. When the medication is applied to the skin, it concentrates mainly in the tissues just beneath the surface, such as the knees, hands, shoulders, or lower back, right where the pain and inflammation are located. Only a very small amount enters the bloodstream. As a result, the risk to the stomach, kidneys, heart, and blood pressure is dramatically lower compared to oral NSAIDs. For older adults with osteoarthritis, muscle pain, or pain confined to a specific area, topical NSAIDs often provide meaningful relief, especially when used consistently and as directed. While the pain relief may not feel as fast or as powerful as a pill, the trade-off is crucial. This approach is far safer for long-term use. In addition to diclofenac gel, pharmacies also carry many other topical pain relief products, including creams or ointments containing menthol, salicylates, or capsaicin. These products create warming or cooling sensations on the skin, which can distract the nervous system and reduce the brain's perception of pain. Their effectiveness varies from person to person, but they share an important benefit: minimal systemic side effects, making them very reasonable options for older adults to try. That said, even topical medications should be used thoughtfully. Keep these precautions in mind. Do not apply to broken, irritated, or infected skin. Do not exceed the recommended dose or frequency. Wash your hands thoroughly after use. Avoid applying the medication and then tightly covering the area with a compression bandage. In clinical practice, many geriatricians view topical NSAIDs as an ideal middle ground, often more effective than acetaminophen in certain cases, yet far safer than oral NSAIDs. Now, I have one very quick question for you. If you have tried topical pain relievers such as gels, creams, or patches and found them helpful, please leave a comment with the number 1. If you have never tried them or never considered this option, please leave a comment with the number 0. Your response will help guide how deeply we explore this approach in the sections ahead. 6. Aspirin and PM pain relievers. Common misconceptions. Older adults should avoid beyond acetaminophen and NSAIDs. There are 2 other categories of pain medications that I frequently see older adults using despite the fact that they are no longer appropriate choices for routine pain relief. These are aspirin and so-called PM pain relievers. Let's start with aspirin. Aspirin is technically a type of NSAID, but it has a much stronger effect on platelets, the blood cells responsible for clotting. Because of this, aspirin was once widely used not only for pain relief but also to prevent heart attacks and strokes. However, modern medical guidance has shifted very clearly on this issue. Today, aspirin is no longer recommended as a routine pain reliever for older adults. The primary reason is the substantially increased risk of bleeding, especially gastrointestinal bleeding, and bleeding in the brain, which rises sharply with age. Even more importantly, low-dose aspirin is no longer recommended for the primary prevention of heart attack or stroke in older adults. Large clinical studies have shown that for this group, the bleeding risks outweigh the potential cardiovascular benefits. Aspirin should now be reserved for secondary prevention, meaning people who have already had a heart attack or stroke, or those with very high cardiovascular risk and a clear, individualized recommendation from their physician. Now let's talk about PM pain relievers. These products are commonly marketed as nighttime pain medications that also help with sleep. What many people do not realize is that the PM component almost always comes from diphenhydramine, an antihistamine with anticholinergic effects. For older adults, anticholinergic medications are particularly harmful to the brain. They can cause daytime drowsiness, confusion, memory problems, poor concentration, and most concerning, a significantly increased risk of falls. In individuals who already have memory impairment or dementia, these medications can noticeably worsen cognitive symptoms, especially when taken repeatedly over several days. For older adults, choosing a pain medication is not just about reducing discomfort. It is about avoiding silent harm to the brain, the digestive system, and overall day-to-day safety. In the next section, we will broaden the conversation beyond medications and discuss effective pain management strategies that rely less on drugs, focusing on approaches that are safer and more supportive of long-term health. 7. Effective pain management do not rely on medications alone. When it comes to chronic pain in older adults, one of the most common mistakes is believing that finding the right medication will solve everything. Clinical experience consistently shows that for most people over 60, the safest and most effective pain control rarely comes from medications alone. As the body ages, it becomes more sensitive to drug side effects, particularly from medications that affect the brain, kidneys, liver, and cardiovascular system. For this reason, modern medicine emphasizes a comprehensive, multimodal approach, combining medications when necessary with non-drug strategies to achieve long-term relief while minimizing risk. One of the most well-supported and effective approaches is physical therapy. Targeted exercises help strengthen muscles, improve joint flexibility, and enhance balance. When the body moves more efficiently, stress on painful joints decreases and pain becomes easier to manage. Just as importantly, physical therapy helps older adults regain confidence in movement, breaking the vicious cycle of pain, reduced activity, muscle weakness, more pain. In addition, therapies such as massage and acupuncture provide meaningful relief for many individuals. While results vary from person to person, these approaches share an important advantage: a low risk of side effects, making them well-suited for long-term use. Another often underestimated factor is the powerful connection between the brain and pain perception. When pain persists, anxiety, stress, and fear can amplify pain signals in the brain. Cognitive behavioral therapies help individuals learn how to cope with pain, reduce excessive focus on discomfort, and improve quality of life even when the pain does not completely disappear. Setting realistic expectations is essential. For many chronic pain conditions related to aging or degeneration, the goal is not to eliminate pain entirely. Instead, the goal is to reduce pain to a manageable level 1 that allows a person to remain active, independent, and engaged in life. In the final section, we will summarize the most important principles to help older adults use pain medications wisely, safely, and in ways that truly support long-term health. 8. The golden principles for using pain relievers in older adults. After reviewing the different medication groups and available options, there are several core principles that every older adult should keep in mind when dealing with pain and the use of pain relievers. These principles are designed not only to improve pain control, but more importantly to protect long-term health. First, acetaminophen, Tylenol, should be considered the first-line option for mild to moderate pain in older adults, as long as the total daily dose does not exceed 3,000 milligrams, and is reduced to 2,000 milligrams per day if there are any concerns about liver function. Second, oral NSAIDs such as ibuprofen or naproxen are not appropriate for daily, long-term use. While they may provide stronger pain relief, the risks to the stomach, kidneys, cardiovascular system, and blood pressure are substantial. If they are used at all, they should be taken only for short periods, at the lowest effective dose, and ideally with guidance from a healthcare professional. Third, prioritize safer alternatives. especially topical NSAIDs such as diclofenac gel, as well as other localized pain relief creams. These options are particularly well suited for joint pain and pain confined to specific areas of the body. Fourth, avoid using aspirin as a routine pain reliever and be especially cautious with medications labeled PM, as these can cause confusion, memory impairment, and a significantly increased risk of falls in older adults. Fifth, do not silently endure ongoing pain. Persistent pain is always an important signal from the body. Speak with your physician or healthcare provider to identify the underlying cause and develop a thoughtful pain management plan rather than relying solely on over-the-counter medications. Finally, remember that medications are only one part of the picture. The most sustainable and safest approach for older adults combines appropriate medication use with physical activity, physical therapy, non-drug therapies, and lifestyle adjustments. Before we conclude, I would like to ask you one final question. If you have used over-the-counter pain relievers and found them helpful, please leave a comment with the number 1. If you are still considering your options or have concerns about using pain medications, please leave a comment with the number 0. Thank you for taking the time to follow along. I hope today's discussion helps you make more informed and confident choices for your own health and for the well-being of those you care about. 9. Closing thoughts. Managing pain wisely for long-term health pain is a common part of aging, but it should never be something older adults are simply expected to endure. The key is not putting up with it, but truly understanding what your body needs and what it can safely tolerate. Pain relievers can offer fast relief, but every pill also carries long-term effects on the liver, kidneys, heart, and brain. As we grow older, these effects become more significant and far more important to weigh carefully. That is why smart pain management is not about finding the strongest medication. It is about choosing the safest, most appropriate, and most sustainable solution. For older adults, this usually means prioritizing medications with lower risk, avoiding frequent use of strong painkillers, combining medication with movement, therapy, and non-drug approaches, paying close attention to even subtle changes in the body. Most importantly, healthcare is not a series of isolated decisions. It is an ongoing partnership between the individual and their healthcare providers. With open communication and proactive planning, we can reduce risks, improve treatment outcomes, and preserve independence and mental clarity as we age. The ultimate goal is not just to reduce pain, it is to maintain mobility, protect quality of life, and continue finding joy in everyday activities. That is the true foundation of healthy aging. Thank you for taking the time to follow this content. I hope the knowledge shared here helps you and your loved ones make wiser, more confident choices so that each day feels lighter, safer, and more fulfilling.